This is my friend Scott, who happens to also be my patient. And today we're doing a refill. He's got a pump, intrathecal morphine pump with a little marking in it. And how long you had it?
I've had it since September 25th, 2015.
Okay, we're almost a year.
Almost a year.
What difference in your life has this made?
Well, my head is clear now. The pain is mostly gone. It's at times 100% gone, and I've started to gain weight again, and my organs aren't suffering. I just feel a lot healthier.
Now, you had been on some oral medicines as well. Were there negatives about those, positives?
Well, of course, it's hard to keep the amount of medicine, because you have to keep on increasing it.
Yeah.
So it was difficult to keep it at a lower dose, but through radio frequency ablations and stuff, and nerve blocks, I was able to do that. And I've been seeing Dr. McRoberts for almost 11 years now. But after a while, the pills take a toll on you.
Yeah.
And that's when I made the decision to ask about the pump.
So we did the pump, and your pain had always been kind of in the same spot all the time, kind of in the back where the neck meets the shoulder blade on that right side, as I recall.
Correct.
And what we did is we mapped out while we were putting the pump right where that spot is, and that's where we put the tip of the catheter to correspond right with that chronic pain in that location. So after we put in the pump, how much pain relief have you gotten with the pump?
How much pain relief?
Yeah.
Oh, it's wonderful. I mean, I get 98% pain relief. At times 100% pain relief.
And previously, I remember, you'd been a drummer for years and years, and that was troublesome to do. Are you able to do stuff like that?
Oh, yeah. As a matter of fact, I played last night for 2 hours straight. So.
That's amazing. Now, that is pretty incredible, actually.
Yeah. I just hit the button, 15 minutes later, no pain, and I can play drums as long as I want. It's great.
That's unbelievable. That's really amazing. So any counsel, I know you had some, you're a thin guy, and so we put the pump actually underneath a layer of fascia to try and pull it inside a little bit, but it's pretty tender for several months.
For me, yeah, it was very tender.
And gradually that went away for the most part?
For the most part.
Still a little sensitive?
It's sensitive, but you know what? If in my case, like the trade-off of the amount of sensitivity to the amount of good that it actually does my spinal pain, it's well worth it.
Wow,
so,
that's awesome.
There's always a little bit of sacrifice, but it was worth it for me.
Any other counsel to other patients who are thinking about, getting off pain meds and trying something like this?
Well, I would say the most important thing is to make absolutely sure you are off of all pain meds before you actually get the pump trial, so that you don't get a false reading. Because pain meds can take, even if you don't have the effect of them a day later or whatever.
Yeah.
I think you should, even if you have to suffer for a week before you actually get the pump trial, so you're really in a lot of pain when you do have the pump trial, to see that it's going to work for you, because that's your chance to know if the pump is actually going to work.
That's an excellent
if
point.
you don't do that, you're only fooling yourself.
That's very
so
true.
It's really, I
counsel.
think that's the most important thing.
Right on.
And then you have to realize that once you are on the pump, there will be no more pills given
that's
to
awesome.
you. So the trial is the most important thing, and I think that your body should be flushed out of all pain medicine for quite a few days before you.
Yeah, we try and go at least a week, and even best if you go 2 weeks for us. So,
I went about a week.
Yeah,
and
it's a good amount.
It worked really well for me.
I appreciate it. Thank you
Okay.
for your candor.
You're welcome.
All right, take care. Now I can put this on YouTube
Yeah.
and whatnot. Thank you.